Hi, I'm Daphne Walker, Director of Health Services for the Jefferson Parish Public School System. The Louisiana Department of Health and Hospitals has provided updated information about this current flu season and its impact around our state. Here are some recommended guidelines to follow in order to prevent yourself and your students from contracting or spreading the flu. The symptoms of the flu include fever over 100 degrees Fahrenheit, cough, sore throat, body aches, headache, chills, and fatigue. For most people, the flu can easily be treated at home with bed rest, fever-reducing, and antiviral medicines. However, people who have underlying medical conditions, women who are pregnant, or very young children should contact their doctor if they develop flu symptoms to see if they need further interventions or medications. Germs are usually spread when a person breathes in respiratory droplets from someone who is sick. Droplets from a cough or sneeze of an infected person move through the air for a short distance, about 3 feet. Germs can also be spread when a person touches something that is contaminated from another person, such as a desk or doorknob, and then touches his own eyes, mouth, or nose before washing hands. To reduce the risk of getting any illness, please do the following. Avoid close contact with people who are sick. If you have cold symptoms or have fever greater than 100.3, stay away from others until you have not had a fever for 24 hours. Do not visit vulnerable loved ones who may be receiving care in a hospital, nursing home, cancer center, or other setting. Do not kiss babies, pregnant women, grandparents, and others who may be at higher risk of getting sick. Call your doctor immediately to see if an antiviral medication is appropriate for you. Cover your cough and sneeze. Try not to touch your eyes, nose, and mouth. Wash your hands frequently. Clean and disinfect surfaces and objects that may be contaminated with germs like the flu. It's not too late to get a flu shot. If you suspect a child has the flu, it is important that he or she does not attend school or go anywhere else, such as group child care, the mall, or sporting events, where other people would be exposed to their flu germs. It is also important to teach children how to reduce the risk of getting the flu and protect others from infection. Teach children to cover coughs and sneezes with tissues or by coughing into the inside of their elbow. Cough or sneeze into your sleeve, not your hands. Teach children to wash their hands often. Washing with soap and water for at least 20 seconds is ideal. That's about as long as it takes to sing the happy birthday song twice. Teach children the proper use of hand sanitizer. If they are too young, they should not use hand sanitizers on their own. Keep hand sanitizers away from young children. Gels, rubs, and hand wipes all work well as long as they contain at least 60% alcohol. Hand wipes must be disposed of properly. Always read and follow label instructions when using hand sanitizer. Teach children to keep their hands away from their face and avoid touching their mouth, nose, or eyes. Help children to learn these healthy habits by setting a good example and always doing them yourself. If we all practice good hygiene, we can limit the spread of flu in our schools and our communities at this time. If you suspect an influenza outbreak in your school or daycare, please immediately contact the Louisiana Office of Public Health Infectious Disease Epidemiology Hotline at 800-256-2748.